Oh, well, there are still a lot of questions when it comes to the coronavirus, including how pregnant women are affected by the virus. And joining us this morning with more on that is Dr. Robert Atlas from Mercy Medical Center. Good morning. It's nice to see you.
It's nice to see you, Jen. Good morning to you.
Let's talk about the risk for pregnant women when it comes to the virus itself.
Yeah, I mean, so the risk to women is no different than anyone else's risk. So it's no different in that respect. However, the problem is if you get COVID, what we're seeing is an increase in hospitalizations, an increase in ICU admissions, as well as there is some slightly increased risk of needing ventilatory support as well. So if you get it, there is an increased risk.
And then what about any sort of preterm birth issues, that sort of thing when it comes to delivery?
Yeah, what we're seeing is those patients who get really critically ill, there is an increased risk of preterm birth. So it is real fluid issue. Most of the patients we're seeing who had COVID are not affected and are asymptomatic. But there are a number of people, and my colleagues over at the University of Maryland have seen a real significantly increased risk of harm to women. And we've all seen some preterm births associated with COVID.
And what are you hearing from your patients who come in? I mean, new moms are definitely have a lot of worries to begin with, but now we're in the middle of a pandemic, so I imagine it's amplified.
I think there's an increase in anxiety about the fear of getting it. I know personally, I have that same fear. And we all have to do what we need to do in order to stay safe. And that's wear the mask, goggles, stay home. So those are the things we have to do.
So when it comes to the coronavirus vaccine, not much is known about how it could affect pregnant women because they were not involved in the trials for either Pfizer or Moderna. So what is the recommendation?
Well, it's interesting. My Society of Maternal Fetal Medicine actually came out with a paper suggesting even though women have not been part of any studies, that they should consider and talk to their doctor about becoming vaccinated. That what we know about the virus makeup itself, it's not a live attenuated vaccine, and we don't believe there would be any additional risk in receiving the vaccine. So the reality is we would, if a woman wants to, we would actually encourage it.
All right, and that's definitely something that they need to talk with their doctor about.
Absolutely. Everything needs to be discussed with them and a conversation that occurs between them about what the risks are. We know there's no risk of fetal anomalies with COVID. The patients that we've seen who have been infected early have not been shown to have an increase in harm to the fetus. And we don't believe there would be any added harm in regard to the vaccination either.
All right, Dr. Atlas, thanks so much for joining us. We certainly appreciate it.
Have a great day.
You too.